The eternal big question in a caring society is how to eradicate poverty. Currently, 1 in 6 Canadians live in poverty. And when you're poor, you're more likely to get sick.
I do have illnesses. I have psoriasis, which is a gene, that you get from your family that you don't necessarily want, but don't have any choice. I also am in phase 4 of a liver disease, Hep C. So it's, it's a bit of a struggle that with that kind of illness, you need to remain active, on the go, but not straining yourself.
I'm a diabetic, and I got an ulcer on the bottom of my left foot after I had my left big toe amputated January the 1st of this year.
I'm borderline personality, and I have no ID because I'm on the streets. I can't get my medication because I have no ID, and in order to get my medication, I need ID.
Dr. Gary Block is a family physician who treats people who live below the poverty line.
From the health provider's perspective, I like to think of social issues like poverty as a disease. Because it is such a massive risk for poor health outcomes that unless we start treating it and dealing with it specifically as a disease, we're going to continue to see those poor health outcomes. The stress is always there, and it's very hard to actually focus in on your body when you're living with a huge amount of stress. It's hard just from the perspective of accessing good food, of being able to afford your medications for some people. Some of the basic things that we expect people to do to work to improve their health just becomes impossible when people are living with the stress of these types of severe social pressures.
When you're rich, you get treated well. And when you don't got that much, you get treated slow. Nobody really pays attention to you.
It's very difficult for me to get the proper health care because I'm not a person of high stature or well high class and stuff. So it's hard for me to get medication to fund.
I mean, there's a huge stigma around poverty. There's no question the prevailing sense in our society is that if people are poor, they did something to cause themselves to be poor. They're lazy, they weren't able to pull themselves up, they missed opportunities earlier on they should have grabbed onto. This is false in almost every case. People who are poor tend to have grown up in poor households and, for many reasons do not have the ability to sort of work their way out of there. We didn't start with a level playing field.
Dr. Block believes doctors can help by learning how to treat disadvantaged people.
Asking everybody about their income is an absolutely essential first step, and then beyond that, actually hearing their stories, so understanding the full totality of their social situation, plays a huge role in framing what my medical interventions will look like. For instance, if someone comes in, they're having a bit of chest pain, it doesn't sound too concerning. If they're a smoker, I say, much more likely to be the heart, I'm going to look at it this way. Similarly with poverty, I start to say, well, if they're living in poverty, more likely to be the heart because of the evidence that I know links poverty with poor outcomes or the higher incidence of heart issues. The third piece is actually understanding how to work with people to increase their income. So to help them access government benefits, disability benefits, child benefits, seniors benefits, these programs that are out there, which can actually result in a huge increase in people's income. I have seen doubling of income or more for my patients just by getting them access to some of the big programs that they should have been accessing all along but didn't actually know about.
Part of the challenge is getting doctors on board.
So what we've done is start to reframe the interventions in a way that doctors can understand. So in a way that fits in with a typical 10 to 15 minute frontline family medicine visit. All I need to do is ask one screening question to see if someone lives in poverty. I need to know 5 or 6 basic income benefits and how to ask whether or not people are accessing them. Right, so not too onerous, and once you show them the impact, so we show them, examples of someone whose income is doubled, like a single mother who's on $14,000 a year, who suddenly goes up to $28,000 a year with child benefits and all the other tax credits, they get it pretty quickly.